Hello, I'm Cassandra McDorman, and I'm going to be speaking on advocating for a patient experiencing psychosis. Advocating for someone experiencing psychosis is important to ensure they receive the right care with respect to their rights, safety, and dignity. A person experiencing a psychotic episode has lost the ability to determine what is real and what is not, therefore, is in need of an advocate. What is psychosis, you ask? Psychosis refers to a group of symptoms affecting the mind, including loss of touch with reality. Psychotic episodes often include hallucinations, delusions, and disorganized thoughts or behaviors. Stereotyping, prejudice, and discrimination are the primary forms of stigma. People who experience stigmatization often suffer direct and indirect harm, which can worsen their symptoms. Stigma poses significant challenges that increase difficulty of seeking help and continuing their treatment. Healthcare professionals have a moral obligation to advocate for clients suffering from a psychotic episode. Advocating includes ensuring access to resources, reducing stigma, and promoting long-term recovery tailored to the individual's needs. Identifying the immediate needs is the first step to ensure safe and effective treatment. Your priority is to ensure the safety of all persons involved. Both mental and physical illness can result in psychotic episodes. Therefore, thorough medical and psychological assessment is needed to determine the cause. If you are not a healthcare professional, build trust with the person through empathy and genuine concern. Respect the current situation without judgment or bias. The psychotic episode is most likely not the first, and the person may be able to offer advice on how to best help them. Communication is the first step in building trust. Be an active listener. Your efforts should avoid triggering conversation or sudden movements that may increase paranoia. Instead, provide clear and transparent information using de-escalation methods. Acknowledge the person's concerns through validation. Safety considerations include developing a personalized approach to guide the person through the episode, including de-escalation techniques. You must secure a safe environment using the least restrictive measures. Ethical and legal considerations include ensuring the person does not pose a threat to himself or others. Can the individual understand treatment options and make informed decisions? Healthcare professionals have a legal obligation to report valid threats to harm self or others. How do we manage the immediate crisis? Crisis management involves engaging care professionals who are current on the evidence-based treatment modalities to ensure the best outcomes. Depending on the location, it may be the first responder. Psychotic episodes can cause distress for family members and caregivers. They should be included in care planning when possible. Ask about previous episodes or recent stressors. Realistic and individualized needs should direct care. Adherence to treatment plans helps to alleviate the burden on family members. Treatment of psychosis includes antipsychotic medication. It is important to determine the most effective medication with the least negative side effects. Other elements of care should include coordinated care to include physical and psychosocial aspects through shared decision making. Treatment compliance will depend on accessibility. Medication education is essential to encourage engagement and recovery. Many people with mental illness abruptly stop their medications due to the negative or positive side effects. A positive side effect is the client believing medication is no longer needed because of the current state of well-being. It's important to empower a person recovering from psychosis by providing resources to assist in regaining their independence. Set realistic goals for returning to previous activities and celebrate the small accomplishments. We must advocate for ethical and practical treatment measures to include compassionate care and empathy. Treatment should include support groups to promote social interaction. People dealing with mental health issues that lead to psychosis often feel isolated and lonely. Long-term support should include a case manager or mental health worker to provide information on resources and access. Many people dealing with mental health issues have little to no social support outside of the mental health services. They need assistance sustaining rewarding relationships outside of their care team members. Mental health issues that can result in psychosis affect over 1 billion people globally. Educating communities is essential to effective advocacy. Understanding psychosis is key to decreasing the stigma and improving care. Many believe persons with mental illness are violent. The risk of violence or suicide decreases with treatment. Success in advocating for clients with psychosis is dependent upon cooperation between the entire healthcare team. Educating communities, friends, and colleagues about psychosis is an important action toward providing patient-centered, holistic care with respect for mental illness. Please see the attached references.